There's a new analysis which was published in the British Medical Journal, and they are worried that £45 billion over that 10-year period could end up being diverted from essential services. So really their worry is that if you are spending more money on new medicines, although that might mean better treatment perhaps for some people who have got perhaps rare diseases or diseases where there's been a new medicine developed that could help it, that the basic services which are being provided for the NHS will not have that money spent on it.
Let's look at the politics of the day. And the Prime Minister has made a formal government apology to the victims of Britain's post-war forced adoption scandal. He described it as a stain on our country's history. Let's take a listen to him speaking in the Commons earlier.
Mr. Speaker, what happened to them and to tens of thousands of mothers, children and families should never have happened. It is a stain on our history. Mothers, many young, vulnerable and without support, were coerced, bullied or misled into feeling that they had no choice but to have their children taken away from them. What a thing to do.
While campaigners are welcoming the apology, many say words are not sufficient. There's been no commitment to financial compensation for those whose lives were permanently changed. Meanwhile, the government's facing growing questions over its public finances, from the cost of higher defence spending to warnings that the UK-US medicines deal could place further pressure on the National Health Service. To discuss all of that, we are joined in the studio by Times Radio political correspondent Terry Stiastny. Good afternoon, Terry.
Hello, Rosie.
So, Keir Starmer was apologising for the state's role in what's an estimated 185,000 babies being taken from unmarried women in England and Wales. Why has the government apologised now?
Well, I think there have been a lot of investigations into this. There was a recommendation from the Education Select Committee that the government should apologise, and a lot of other institutions, places like the Church of England has already apologised. There have been apologies in Wales, Scotland. We're expecting to get one from Northern Ireland. So this is, a scandal that has been going on for years, and the more people look into it, I think there's a feeling that, both the mothers whose babies were put up by adoption forcibly and their children were owed that apology before it's too late.
Yeah, I mean, what they've got today is an apology, but as I mentioned, not compensation. There has been schemes in Australia and Ireland that did offer compensation. Why do we think that this government have decided not to do that?
Well, the government has decided to put the money instead. They've got a £4 million support fund, which is going to go into things like helping people to access their adoption records, making sure that those records are kept so that people can actually find out the truth about their own families. And it's also going to go into research projects and also things like mental health support, for instance, for people who've been affected by this, peer support groups and what's called trauma-informed support. So I think they feel that the money is better spent on trying to help people with the problems that they have rather than just financial compensation.
Yeah, well, and extremely traumatic situations for many of those families and individuals as well who realise they've been caught up in it. Should we talk about the US-UK medicines deal? Before we get into the detail, just remind us what the deal is.
Yeah, this was basically a deal which was done between the UK and the United States, and in return for the US saying that they wouldn't impose tariffs on UK pharmaceutical and medical technology exports, there's a deal that's going to last for 3 years until 2029. The UK government said that what it would do as part of that is say the NHS is going to spend more money on new medicines, and so that's over a 10-year period. The NHS has promised that it will spend 12% of the NHS budget on medicines compared with 10%, which it currently is now. So that is part of the trade-off. We get access to the UK markets, but in return we promise the NHS, who's of course a big customer, will spend a lot more money on buying potentially expensive medicines.
So what's the concern then about how it could increase the NHS's costs?
Well, there's a new analysis which was published in the British Medical Journal, and they are worried that £45 billion over that 10-year period could end up being diverted from essential services. So really they're worried worry is that if you are spending more money on new medicines, although that might mean better treatment perhaps for some people who have got perhaps rare diseases or diseases where there's been a new medicine developed that could help it, that the basic services which are being provided for the NHS will not have that money spent on it. So they are concerned about this. And what's going to happen is that NICE, which decides whether a medicine is worth spending the NHS's money on, is going to change its thresholds for cost effectiveness. So they work out, what quality of life, what length of life a new drug can give you, and they're going to sort of tilt that a bit more towards, providing the more expensive medicines.
OK, talking about other things in government budgets, if we turn to defence spending now, Andy Burnham, The Times is reporting, is going to be forced to find almost £7 billion worth of cuts to schools, hospitals, roads, energy projects to pay for increased defence spending. It's going to ultimately, Terry, be one of the first things he has to do as Prime Minister to get this plan over the line. That's on top of the nearly £5 billion that Burnham's Chancellor will have to find to pay for the unfunded element of the Defence Investment Plan. What position does this put Andy Burnham in?
It puts him and whoever ends up being his Chancellor in quite a difficult position. Yet, as you say, they will have to, at the next budget, find the £5 billion from somewhere. But also, it hasn't yet entirely been decided where the cuts to capital expenditure and infrastructure projects are going to come from. So that could mean, we've already heard about some road projects, for instance, that might not happen. This could mean that certain hospitals don't get rebuilt, or that school construction projects won't happen, or the rail investment won't happen. A lot of the money is going to come from transport and energy costs. And of course the political cost for this is that every road project, every hospital, every school has an MP who has probably promised their constituents that you are going to have better services which are going to be built. And we've already seen some MPs and even ministers turn around and say, we're disappointed that road is not going to be built in my constituency.
Yeah, and Andy Burnham's going to have such an interesting relationship with his MPs, because he's already said he's not going to whip them. And you think, well, if they're going to be disgruntled about one thing or the other, they have got form, these Labour MPs, for being very prepared to say, I don't want to do as I'm told, even when I am being whipped. This may complicate things even more.
I think, yes, good luck with the not whipping project, because we've already seen a couple of people who rebelled over welfare reform, for instance, firing a bit of a warning shot and saying, it's very important that we keep welfare payments, financial security for disabled people and for people who are not well paid. People saying that we should be funding welfare, not weapons. If those are the kind of people who rebelled against Keir Starmer, they are, possibly quite likely to rebel against Andy Burnham.
Terry, thank you very much for the context. That's Terry Stiastny, Times Radio's political correspondent. Listening to that conversation is Carl Emmerson, partner at London Economics, working in their public policy practice. Good afternoon, Carl.
Good afternoon.
What are the options then that the Prime Minister in waiting has to find the money? That's the £7 billion worth of cuts plus the £4.7 billion worth of savings that they need to pay for what is currently the unfunded part of the Defence Investment Plan that's now already been published.
I mean, stepping back a bit, essentially the next Prime Minister, next Chancellor will have lots of options. There's lots of things they can do, to taxes, to spending. They can reallocate money towards health away from other areas. They can spend more in total if they're prepared to tax more. There's lots of options on the table. I think what's really hard is the fact that because we've had such weak economic performance for getting on for like 18 years now, the options don't look very attractive. If the economy's growing, people's wages are rising, they're naturally paying more in tax, the choices you're faced with just look a lot easier. You've got extra money coming into the Treasury. You're thinking, how do I spend this extra? If you do put taxes up on people, they might still see their household incomes rise, even though they're paying more in tax. But in a world where the economy is just growing much less quickly, wage growth looks terrible, it gets much harder because you haven't got the fruits of that growth. So your choices all look like, well, if I want to do more in this area, I've got to do less in another area. And I think defence is particularly difficult for the government because for many, many years, successive governments, successive chancellors have enjoyed a peace dividend where essentially we've cut defence spending as a share of GDP with the end of the Cold War, with peace in Northern Ireland. And essentially we've used the money to increase the share of our national income we spend on health because we want a better health service. And going forward, what's going to be very, very difficult is for the first time in many decades, it looks like we're going to be increasing both defence and health spending at the same time. rather than using defence cuts essentially to pay for health increases.
Yeah, I mean, one of the sort of claims that's coming out from the government ministers say it's normal that the defence plan is sort of partially unfunded. All of that will become clear in the autumn budget. Does that make sense to you? Does that stand up?
Well, unfortunately, it does, in that I think that of all stripes, politicians are often keener to tell us about perhaps the nice things. We're going to increase spending on that. We're going to increase spending on this. We're going to cut this tax. Whereas the detail you tend to get around, well, how are you funding it, tends to be less clear, tends to come with a lag. So I'm not really surprised, but it's clearly much, much easier to say, I want to increase the defence budget, I want to spend much more on defence, I want to meet the commitments I've made to NATO, for example, that the Prime Minister's made, than it is to say, well, this is the area of spending which I quite like, but actually I'm going to deprioritise it because I think defence is more important. That's a harder thing to do. Or to say, well, I know that taxes are at a record level for the UK standards, so I know they're already rising, but I'm going to put them up even more because although I don't like putting up taxes, I do need the money for defence. That's just a harder thing to do, a harder sell. And that's what whoever becomes Prime Minister is going to have to face up to and is going to have to convince people of.
I wonder if the change of leadership at Number 10 actually provides an opportunity. Will it be easier to make tougher decisions now than it wouldn't have been if Keir Starmer stayed as Prime Minister?
There might be some truth in that. I mean, certainly when you see a new government, particularly if it's a change from Labour to Conservative or Conservative to Labour, you often see harder choices taken initially on the public finances. So what I mean is you often see increases in taxes at that point in time. Now, of course, this is not happening after a general election. It's happening in the middle of a parliament, which perhaps makes it a bit more complicated. But at least if it's Andy Burnham or whoever becomes Prime Minister, whoever he or she chooses as their Chancellor, perhaps they're not quite as committed to the spending review settlements that were agreed last year. Perhaps they're prepared to look again at certain tax options, which means that they might have more choices available to them. It's not that those choices are necessarily very attractive. There's good reasons why Keir Starmer, Rachel Reeves didn't make them before, but perhaps at least they can be revisited.
What about what we just heard from Terry Stiastny, our political correspondent, that some Labour MPs are saying welfare, not weapons, and they are frustrated by the sort of months-long conversation now we've been having about what to spend on defence, and ultimately that's sort of what kind of unpicked the final bit of Keir Starmer's authority, as his then at the time Defence Secretary had to bow out and said, look, I can't stand behind this defence investment plan as it is. How strong is the argument, do you think, to say we need to prioritise welfare over weapons, which is the case some of those Labour MPs will be making?
Well, it's another area where we have choices. I think within the working age social security budget, it's important to remember that overall that's not been growing in recent years as a share of national income, but the proportion of it which goes on people who are in ill health, claiming support for incapacity or disability, has been growing really very, very sharply. So I think it does make sense for us to make sure that that support is being well targeted and really helping individuals that it should help, helping them manage their health conditions, helping them return to work where that's appropriate. I mean, that's certainly a very clear case for that. There's then the second question about, are we happy with the budgetary consequences of what's going on, where we have more children, more working age people and more pensioners successfully qualifying for those benefits and therefore receiving more money. And that's one of the reasons why spending has been growing overall pretty sharply, and one of the reasons why, despite having that high tax burden, perhaps we don't feel that our public services are delivering us all that we want, because we're spending actually quite a lot of the extra money is going on supporting people with health problems, disabilities. Another slice of it is going on debt interest, so they're not going necessarily on the things that many taxpayers enjoy, like quality public services.
Carl, it's been really interesting. Thank you. Carl Emmerson is a partner at London Economics who works in their public policy practice.